Okay, ma'am, I'm ready.
Okay, so if you've read and understood, considering it's surgical augmentation, please tell me what are you looking at?
I'm looking at stomach,
Complete answer, please. Stomach along with
hepatorenal area,
wait,
and
where exactly are you reaching? Along with this stomach, what is this hanging part?
this is omentum,
Yes. So
greater omentum.
lesser and greater sac or omentum along with. Okay, please tell me what are the parts of the stomach?
Stomach has fundus, body, pyloric antrum, and pyloric canal.
Very good. Okay, right. If you could please kindly identify number 6.
It is fundus of the stomach.
Okay, and 2, please.
2 is body.
Right, moving on. If you could identify this, 9. This is
This is
19,
pyloric.
18,
18 is
18,
pyloric antrum, and 19 is pylorus or pyloric canal.
all right, and then 23.
This is first part of the abdomen.
Okay, right. If you could tell me what is the blood supply of the stomach?
Uh, Blood supply of the stomach is left gastric artery, right gastric artery, left gastroepiploic artery, and right gastroepiploic artery,
And
and
the
also
yes,
splenic artery supplies part of.
and please tell me the venous drainage as well.
Uh, Left gastric, right gastric, and
Draining
okay,
into portal vein and
into portal vein, and short gastric and splenic artery draining into the splenic vein, or
wait, left gastroepiploic plus short gastric vein. They are draining into splenic vein.
splenic vein,
And then
and
right gastroepiploic is draining directly into.
superior mesenteric vein.
Yes. All right. Okay. Whereas, all right. Okay. Please tell me what are the relations of the bed of the stomach, or what are the
Like
structures which are present in the bed of in the back of the stomach, or the back relation of the stomach? It's called the bed
uh,
of the stomach. Yes.
yes, that would be uh, duodenum. Sorry. Uh,
Duodenum is a big
that,
term. Yes.
yes, that would be right renal vein, left renal vein and lunar artery, and the splenic artery, pancreas, body of pancreas,
Yes. Head of the pancreas and the body. Yes. And
and left renal artery and vein, and also
okay. Left.
splenic artery.
Okay. Okay, left side. And anything else?
And I think and inferior vena cava and aorta.
All right, please. Please tell me what is the most common carcinoma of the stomach?
Uh, that is adenocarcinoma.
Yes. What are the risk factors for adenocarcinoma?
Uh, any changes like acidity, any peptic ulcer disease,
Okay,
or
peptic ulcer 1. And so that means it's
smoke.
hereditary. What are the genes which are involved?
Sorry, ma'am.
Okay, what
This
are the
side.
classification? How would you classify the gastric carcinoma?
Uh, there are MALT 1 and MALT 2, then there are adenocarcinomas, squamous cell carcinomas, gastrinomas.
The classification, how would you classify, or is there any terminology that you know?
No, ma'am.
Okay, what is the treatment of gastric carcinoma?
Uh, we can do gastrectomy, or we can give chemotherapy to the patient.
You don't do chemotherapy. Okay, what is the prognosis of gastric carcinoma?
Sorry, ma'am, I also
Yes,
did
it's
not.
always diagnosed advanced, so prognosis is very poor. Please tell me what kind of image A, B, C are you looking at?
This is, I think, barium swallow.
Okay. Of all right. Okay. Okay. Esophagus. Please tell me what is the lining epithelium of esophagus? All three parts, upper,
It
middle,
is
and lower.
okay. It's a keratinized, stratified squamous epithelium, the epithelial lining of esophagus.
Where?
But the
Okay, upper
the
part normally. Yes.
the upper part, the muscle, there are striated muscles. Middle part, there are both striated and smooth muscles, and lower part, there are only smooth muscles.
Yes. Okay. Would you be able to identify the marked structures? What is 3?
This is lower part of esophagus.
Okay. 6.
This is upper part.
7.
7 is thyroid cartilage.
Okay. Right. What do you see in the image B? Would you be able to interpret it for me? What is 1 and what is 2? What exactly is this?
I don't know.
So, right, number 5 and 6, number 5 and 9. What do you see?
Okay. Yeah, there
This,
is stricture at the number 4 of the esophagus,
yeah,
showing decreased movement, probably achalasia of the
okay,
esophagus.
yes, mobility problem, all right, okay. What are the conditions or the indications for asking for barium swallow?
If patient have any dysphagia, vomiting, or any difficulty in eating or dysphagia.
Just dysphagia, all right. In other words, you could say when a patient is complaining of obstruction or difficulty in swallowing, so does not have to be direct, could be
Okay.
outside as well, just like okay, there could be like in the mediastinum some obstruction or something which is causing or uh, causing or projecting compression symptoms. I don't know if I'm saying it right. All right. Okay. Please
Okay.
tell me the blood supply of the esophagus last towards the end.
The
Then we can.
yes, upper third is supplied by the inferior thyroid, middle third from the branches directly from the thoracic aorta, and lower third is supplied by the left gastric artery.
Okay. And all the 3 parts of the esophagus have different types of carcinomas because they all have different types of lining epithelium. And their management also differs. Kindly tell me.
Yes, the upper two-third is more possible to have squamous cell carcinoma, and the lower third is more possible to have adenocarcinoma due to the metaplasia of the columnar into columnar epithelium with goblet cells
Yes.
that leads to adenocarcinoma
So
formation.
all these 3 parts of esophagus have different type of management if they happen to have a carcinoma. Please tell me what is the treatment of carcinoma of a lower 1/3?
I think we can do the esophagectomy and transposition of colon along with it. And we can also give post-op radiotherapy. And in the upper third, mostly we do the stunting. We don't do the esophagectomy. We do either stunting
For the
or any.
middle 1/3, yes, stenting. Right. There are other certain names of the procedures which are done for upper 1/3 and the lower 1/3. Please tell me where exactly begins esophagus?
It begins at the pharynx.
Lobe of cricoid cartilage, C6. You told me
No.
the blood supply of the esophagus, right?
Yes, ma'am.
All right, please tell me what is Barrett's esophagus?
It is the metaplasia of into the
Columnar.
columnar
Yes.
epithelium with goblet cell formation
Yes,
that
and
causes
this causes which type of carcinoma?
adenocarcinoma.
Very good. Please tell me what do you understand by ecclesia cardia?
This is a motility disorder in
Yes.
which there is absence of the mesenteric plexus causing increased contraction of the lower esophageal sphincter and decreased relaxation and also a motility problem in the lower part of the esophagus.
Okay, please tell me what makes the indent on the esophagus?
Yes, there are three indents on
Yes.
esophagus.
Yes.
Aortic arch
Yes.
makes an indent. Then I think there,
Left bronchus and left atrium.
yes, left
Right.
bronchus and left
Okay, please tell me if a patient presents with perforated esophagus, what would be the result of it or what would be the complications?
if the perforation is small, it would only cause mediastinitis that can be conservatively managed. But if there is large perforation, that can lead to mediastinitis, sepsis, and more severe consequences, which needs operation of
Surgical
surgery.
intervention. Okay, right. All right, you are just suppose you are assisting a patient who has to go through endoscopy and
Okay.
all of a sudden your assistant distracted you and you happen to perforate the wall of esophagus of your patient. How would the patient present? Like what would be the first symptom with which you will confirm that because of the ignorance or because of the little negligence patient has suffered with perforated esophagus?
Patient may
Ruptured.
earlier present with the surgical emphysema
The
or
first complaint would be pain. In
pain. Yes.
Yes, inappropriate. So you'll know that you have. Okay, please tell me what are you looking at?
This is, I think, barium, not follow through, but yes, barium follow through. I think.
Yes. So what is 1? What is 3? What is 2? 4, 5, 6?
One is esophagus. Three is cardia of the stomach. Two is fundus. Four is duodenum, and I don't know about 5 and 6.
4 is not okay. First part of duodenum, you could say. Yes. All right. Okay. Right. Thank you.
Thank you.